Hey, welcome to today's workout is specifically designed for those of you who low back pain limits you. Maybe you're actively in a low back flare up. Maybe you have chronic low back pain and you go to the doctor and what do they say? Well, you need a stronger core. And you think that's great and all, but every time I do core, I flare at my back. And so then the cycle continues. And so I want to give you something that you can do successfully because you know that stronger core would help your low back. But if you're stuck in this cycle of every time I work it, I'm struggling and I have pain, this is your go-to. Okay, so can be your pain management. This can be your go-to workout when you're in a flare-up, whatever it is. And the first thing that we do need to start with is always going back to the foundation, going back to the breath. And so I'm just going to give a quick refresher of making sure when you're inhaling that belly is expanding, big, open like a balloon. And then when you exhale, we're going to utilize this exhale and utilize this breath of blowing out through a straw. And that blowout through the straw is going to start bringing those abs inward. It's going to start getting that lower portion. A lot of you complain about, well, I'm good at my upper abs because we're really good about clenching here. But getting that lower, feeling that draw up and in, that's going to get the lower abs, the pelvic floor, and it's going to help cinch up this whole canister that you definitely need for your low back. Okay, so just remember the breath as we work through this. And we're going to start on all fours. And let's just start getting a couple breaths. Inhale, belly drops, and exhale, belly lifts. Okay, just do a couple at your own pace. Inhale, we're just starting to stabilize through the back and the abs. And exhale. And give yourself that check every once in a while. Like, am I kicking that in or am I punching it out? Inhaling and exhale. Okay, so that is your foundation for everything that we do. All right, so let's start with inhale, and then we're going to exhale, row the arm up, and control, bring it down. Let's alternate. Inhale, exhale. Okay, so let's just keep doing that. Make sure you're cueing in that breath. Anyone can just stand here and move your arms, okay? But you're not going to get the value out of it. Exhaling, lift. Sometimes just slowing it down and controlling is going to give you so much value. And especially when you're dealing with the low back pain. All right, keep going, inhaling it and exhaling it. Inhale, exhale, lift, draw it, cinch that whole canister up and in. Inhale, exhale. Okay, let's do one more. Inhale and exhale. Okay, let's stay here and let's still work on that breath and let's just start shifting our weight side to side. Okay, so feeling the weight shift. We're not twisting, we're not hinging. Watch your back. We're staying nice and flat. And again, inhaling and exhaling. Inhale through it and then shift. Exhale as you shift. Inhale, exhale, shift and control. Okay, this is slow, control, going back to that breath. Inhale and exhale. All right, we're going to do one more with our hands. So again, inhaling big, exhale, lifting it up. And as we exhale up, we're just going to tap the hand in front of us, okay? Inhale, exhale, tap. This is important because, in real life, we have to reach. We reach overhead, we reach out of our base of support. And so starting here, this can help start stabilizing the system to be able to get, when we take it upright, to take it into reaching, okay? Inhale, exhale. Just go at your own pace. And you get to choose also, maybe you need to bring your knees a little bit closer. So that's one modification that you can do is if you're struggling, like this is going to be more challenging having your knees away. And that's a progression. That's a great progression. But if you're not there yet and you're feeling like I'm just really struggling to get my breath and control it, then bring your knees a little closer. Keep going, keep tapping it forward. Just get that reach and bringing it back. Inhale, reach. Let's do one more on each side. Inhale, exhale, reach. Inhale, big belly. Exhale, reach. Okay, let's do a few things on all fours. So let's take it down and let's just start again. Let's just start our breath on our backs. Inhale, big belly. Exhale, blow out through that straw. Feel those hip bones poking out here. Bring your hands just a little bit to the inside. And as you inhale, feel them push out. And then as you exhale, feel your hands kind of dive in a little bit as those guys start kicking in. If you haven't woken these up in a very long time, it might be a little challenging, okay? So just feel like, okay, is it diving in or is it punching and clenching out? Okay, we want to feel that subtle dive. It might not be super firm. That's okay. All right, now let's lift one leg. So we're going to have one leg at about 90 degrees at the knee, 90 degrees at the hip. And we're going to keep that nice and engaged and alternate our hands back and forth. Okay. Again, just don't forget, you do need to breathe. Don't overthink the breath, just where it feels natural. Inhale and exhale. It doesn't matter if you inhale on the way on the arm up or back. Don't worry about that, okay? Just worry about breathing and drawing it in. If you're struggling to keep your knee up or if it is starting to hurt your back, just bring that knee down, but give yourself a little toe touch, okay? So just a touch down. It's just going to change the positioning just a little bit by having, or just a little bit of the foot up. Maybe you're not ready for the 90 degrees. That's okay. Okay. Let's lift the other leg. Again, going back to your foundation and alternating again. Inhaling and exhaling. If you want, you can use that other hand when the hand's down to give yourself that check. Now, this might look familiar. Maybe you've done an exercise and you might have done it in physical therapy before of like a dead bug kind of thing. And like anyone can just wave their arm around or just go through the motions. But are you using your hip flexors or are you cueing in that core set, that system? And play around with it. It might feel different. Inhale with your hands up. Exhale as you reach. Okay, it's different each dynamic. And then again, always toe touch if you need to. Inhale. Okay, let's take that march. But again, we're not just gonna flail our arms or our legs around. We're going to cue in the breath. Inhale, exhale, and march that leg up. Control, 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 back down. Inhale, exhale, lift the other leg. I know this feels tedious and slow, but this is the foundation. And if you're dealing with low back pain, you need the foundation to keep it going. So making sure these fundamentals are there so that you can do the other things. Keep inhaling, exhale, march and lift. And you don't have to lift high. Again, if you're in an active flare-up, maybe you're barely lifting that leg. But go back to that breath. Inhale it and exhale it. Control as you lift. Feel, is it coming in? Am I punching out? Is my back doing all sorts of crazy things? It's not about tucking the butt, okay? A lot of physical therapists, a lot of doctors, a lot of health coaches are going to teach you this posterior pelvic tilt, but what that actually does is it actually forces you to clench right underneath your rib cage. And we want to work on lifting that system up and not just clenching right at the rib cage. You want to get this whole cylinder working. All right, one more each leg. Inhale and exhale. Okay, we are going to take our hands and we're going to alternate like a reverse fly in and out. So here's your choices. You can keep your feet on the ground, or you can bring your knee up, or you can toe touch a little bit. But again, inhaling, exhaling, open, bring it in, inhale, exhale, open. Just going back to that breath, slow and controlled. Inhale, maybe check yourself every once in a while. This is something like I need to check myself. Like sometimes it's easy to just get caught up in the motion and all of a sudden you notice that your belly is doming or you're just clenching underneath your rib cage. Just watch yourself. I have the tendency also to want to clench. And so go back, slow it down, and bring it back. All right, one more. Okay, other leg, again, toe touch, keep both feet down or lift it up just a tiny bit. Totally cool wherever you are. Inhale, exhale. Inhale. You might feel that pelvic floor starting to lift a little bit, feeling some drawing up and in versus the traditional just clench it, okay? This is not about clenching. This is about like feeling that firmness of the whole cylinder. Opening it up. Do one more on each hand. And you could even add weights if when you start to feel better, you could add some small hand weights to this. Okay, let's bring it down. Let's do one last thing. Again, going back to our breath. And we're going to work on a trunk rotation. But again, a lot of times you might be taught just flopping around. Like it's a great hip stretch, and that's fine. But we're going to focus on that breath again. Focus on the core. Exhale. And you don't have to let your hips flop all the way. In fact, we want to feel that like catching point of, oh yeah, my abs are catching in. Control, bring it back. Inhale, exhale, control it back. Feel it. Feel the abs stop you, not just collapsing into it. Okay. Feel that stick point that, oh yeah, my abs are stopping. That's with rotation. Rotation challenges a lot of people with low back pain. And the problem is usually that the abs and the hips are not talking to each other, and the abs are not helping stop and control the motion. So this is starting to teach your hips, teach your back to rotate, but teaching yourself this control of, hang on, I got to stick it, I got to catch it, I got to control that rotation. Feel it, like feel that it's drawing in, not that it's pushing out. Let's do one more. And control it on the way back. And then let's roll to the side to sit up and push yourself instead of just doing that sit up to get up. All right, I hope that was helpful. Keep this in your library for when you have active flare-ups, if you're in an active flare-up, and keep your low back safe and successful. This is the foundation to everything that you do, starting to activate that core and building that core so that hopefully your low back is no longer this limiting factor in your life.